Hello, friends. 2 weeks ago, I got my colon removed and I got an ileostomy put on my abdomen. I've had colitis and Crohn's disease for 8 years now. I got diagnosed in seventh grade, and I was 13 years old, and I've been through just about every single medication possible, all the TNF inhibitors, all the steroids, all the enemas, all the foams, all the anti-inflammatories, all the diets, with the exception of like one maybe. And eventually it just became time to take the surgery route. But I'm making this video because when you get your information online through, the usual social apps like Instagram and Reddit and Facebook and YouTube, although I will say YouTube's a little bit better in this aspect, but you tend to find a lot of horror stories, a lot of like really terrible sounding experiences. Like, I was overseas and then I had a bowel obstruction out of nowhere, completely out of nowhere, and then I got put in a coma because it was so bad and I lost so much blood, and then I woke up and I had triple the amount of toes and like a few less limbs, right? Some crazy stuff like that usually. But I'm making the video because I had a totally normal experience. I'm a super healthy guy outside of the terrible autoimmune issues. So I guess maybe it wasn't even normal. It might have been better. It might have been a good experience, really. So I had to do a similar to like a colonoscopy prep before the surgery, which I had been fasting until dinner at this point because I have what they call dead gut, which is just like when you're getting thrown medications and your inflammation's super high, and it's been super high for like super long, and you're just losing like all of the important cells in your intestines, so eventually it just like dies, like the large intestine. And I work a lot, over 40 hours a week. I exercise a lot. I'm a personal trainer, a fitness instructor, and so I had to limit my meals. So I would have one meal a day that was like steak and rice. I was probably consuming like 1,500 calories a day just in that one meal, because that's what I had to do to survive. But then I had the prep for the surgery on a Wednesday, and it's just like colonoscopy prep. So it was like, a ton of Miralax and some Dulcolax, and you just shit your brains out. And it was terrible. Every time I do it, it gets worse, I feel like. So I have the prep on a Wednesday, and the surgery on a Thursday, very late in the day also. I think it was like 4 o'clock. I have the surgery around then. It takes a few hours. I wake up at like 7:30, 8 or something like that. And, she said everything went fine. I was like the perfect patient, right? I've got a nice midsection to work with. All the rest of my organs are super healthy. I eat well, I exercise a ton, I'm lean. I'm everything you want in somebody to operate in. I'm young, right? I'm only 21. Recovery-wise, let's see, I was in the hospital for 3 days, I think. I woke up that Thursday night, and then we had Friday, Saturday, Sunday, and I went home Monday. They start you off clear liquids. You got a catheter in. I got the catheter out after a day. That sucked. As in the catheter, of course, it sucked. Clear liquid diet, that's something I'm used to after operations. And then after that, and that was just one day. So then the following day, Saturday, I was back eating normal, shitty hospital food, and then you just sort of get monitored. And I can go into detail about that whole process if anybody's curious, but I'm just saying that everything went very well. I got out a day earlier than they expect. Then I got sent home. My abs were very sore, obviously, right? You get 4 laparoscopic incisions, and then you get the ileostomy pulled through and stitched to the abs, that sort of thing. And yeah, so my abs were sore. I couldn't contract my abs. And when I was walking upright, I couldn't actually lengthen like the rectus abdominis muscle. So I was sort of like hunched over because it just wasn't comfortable to lengthen fully, probably because of all the stitching and the glue and the scars, right? So I got home quicker than they expected. The surgeon wanted to see me on Monday. I ended up leaving before they could see me because I was just doing very well, and they want to use the hospital room for somebody who needs it. I had people on the floor that were post liver transplant or kidney transplant, whatever, organ transplants all over the place. So I got sent home. They have you monitor everything with binder, and you track your input and your output, blah, blah, blah. They wanted a traveling nurse to come check on me a couple times a week to look at the ostomy, the stoma, make sure I'm doing everything right, to get my vitals, everything like that. But then my first visit, she came and I told her I was going to go back to work because I felt fine. I was a little bit low on energy. I was a little bit sore, typical getting out of hospital feeling because you atrophy a ton, right? And I've had so many hospital stays now because of this condition, and this one wasn't even bad compared to some of the other ones. So the traveling nurse came and she's like, "Oh, you're gonna go back to work." She's like, "I don't think we can come to your home if you're going back to work, because they expect you to be bedridden for or homebound, not bedridden, homebound for 14 days, 2 weeks, I think." So I was like, yeah, I mean, I appreciate it, but I'm not staying home any longer if I'm in good enough health to go back to work, which I guess debatably maybe I wasn't. I probably jumped the gun a little bit, but I like to work, I like to be busy. I get depressed and anxious if I'm not busy. So I told her, I'm like, it was nice meeting you. See ya then, because I got to go back to work. So let's see, recovery wise. So it was 1 week. So I had the surgery very late on a Thursday, and I went back to work the following Thursday. And I was hunched over a little bit because of what I said with my abs. And I was tired. I was just very druggy, obviously, right? So I went back on a Thursday. I did a 4-hour shift. Friday I did a 4-hour shift. Saturday I did a 6-hour shift, and then that Sunday I started back full time. So 40 hours a week after that. They put a lifting restriction on me. It was like, you can't lift 10 pounds for 8 weeks. You can't lift over 10 pounds for 8 weeks, whatever. And I get frustrated with stuff like that. So I, right when I got home, I maxed out on bicep curls because I didn't use my abs. So I'm like, oh, why not? Okay, well. So what was I saying? Oh yeah, so sort of just in spite of them trying to prey on my downfall, I got right back into lifting. And I didn't get any injuries, surprisingly. I had a ton of single joint work because I can't use my abs, and I would use my opposing side. I'd grab something so that I wasn't contracting my abs. No issues. I enjoyed it. That's what I needed. I needed the dopamine rush of training because I just enjoy it. So I went right back to work full time. I got back into training every day. I did just grip strength for a while, for like a whole week, and then I got back into actual training. That's where I'm at now. It's been 2 weeks exactly. So I think I'll make more videos into more specifics of the process and where I'm going from here, because they finalized my diagnosis as ulcerative colitis. So I'm a J-pouch candidate. So I'll go into what a J-pouch is, and I'm getting that surgery. So this is the first of 3 surgeries, and I'll go into that in a different video. But I'm just making the video, really. The whole point here is just there are actually people who have illnesses, or they have to get operations, or something just happens and they're fine. Like, it's just a normal thing. Nothing crazy always happens. I mean, it couldn't have been really better for me, as much as it sucks. Like, now I like shit in a bag that's attached to the front of me, and it's like a pain. It's a pain. It's inconvenient. I don't enjoy it. I wish I was just in really good health. I didn't have to do this at all. But like, it really wasn't a bad experience. Like, anybody could do it. The bad things aren't always going to happen. So that's the main point of the video. If you're interested in anything specific about Crohn's, colitis, about the J-pouch surgeries, about this surgery, about the recovery, or about training, that's what I started off on YouTube as. You can look at my old videos. I used to be quite strong in high school. I was big and strong. I was like 215. Now I'm 165. So it's like a toll on me after a while. But any questions you might have, please ask them. Don't be shy. I don't have friends, so I don't socialize much. Please reach out. I'll make any video on anything ever. Yeah. So thanks for listening, if you listened. I don't know if liking and subscribing helps, but I hear everybody else say that. So maybe like and subscribe, and leave a comment on what you want me to talk about, or if you have any questions on anything at all, and I'll answer them, I promise. Thanks. Have a good day.